Choubey. Nice to see you. We're just waiting for others to come in, but maybe while we wait, if you can please rename yourself with your organization to your right, that would be awesome. Thank you so much. Welcome to the session. Great. Hi, Sonia. Welcome to the session. We're just waiting for others to come in, but while we do, if you can please rename yourself with your organization to the right, just so we know who's in the room, that would be great. Thank you. Welcome again, everyone. Our session today is on nurturing innovation in maternal and reproductive health. We're just waiting for others to come in. While we do, if you want to say hi through the chat, that'll be really great. You can introduce yourself, where you're from, what you do, what organization, so that we get to know the people that's currently in the room. Again, for those who just started joining, if you can please rename yourself with your organization to the right, that would be great for us to know who's in the room. Awesome. Again, if you want to say hi in the comments, that will be great. You can introduce yourself, what you do, where you're from, even share a fun fact. That will be greatly appreciated. Okay, we're just waiting for others. We'll give maybe another 2 minutes for other participants to come into the room. Again, we'll be starting in 2 minutes. We'll just wait for others. Okay, all right. So good day, everyone. Good morning, good afternoon. And I'd like to officially welcome us to the Healthcare Incubation State of Play, Nurturing Innovation in Maternal and Reproductive Health. This is our third installment in our Healthcare Incubation State of Play. We did one on health tech, and then we did one on mental health. And now we are here talking about maternal and reproductive health. We celebrated World Health Day a few days ago, and this is our way of commemorating it and really promoting what maternal and reproductive health looks like and the innovations that have uh, really blossomed in the global south and different emerging markets. And I'm so happy to see that we have an all-woman speaker lineup today to commemorate this day. And just to get us started, we'd love to know who's in the room and where you're all from. So we will start with our Mentimeter as we do usually at Pollinate. So if you can join us at menti.com and use the code displayed on the screen. So 8833-4624. And I think Madura's also placed it on the chat. So we'll wait for all of you to come over. I see a big congregation of Philippines here. The Villgro Philippines team is in full fledged today. Cambodia, awesome. So Philippines, Cambodia, I see some people from India. If you can join us at the Menti, that would be great. Awesome. Thanks, Mowgli, for introducing yourself in the chat. Welcome to the session. Kenya, great. Welcome. Okay, awesome. All right, maybe we can move to the next slide, Madura. Great, great. We want to know who's in the room, what best describes your organization. I'm guessing most of, if not all of the participants are incubators and accelerators. Yes, looks like we have a good mix of incubators and accelerators here. Let's move to our last slide, Madura. Yeah, this is one that I'm very curious to see what's the most exciting maternal or reproductive health innovation or venture that you've seen. So whether that's in your local market or something that you've seen online and has really like wowed you, we'd love to know. So somebody mentioned reusable period products. I'm guessing like the cups, the silicone cups, and the eco-friendly ones that are made from bamboo I've seen recently, liners and pads, affordable teleconsulting. So being able to talk to a professional on through a call or online, definitely a great innovation in itself. Anything else? Any other exciting ones? You can also put it on the chat if Menti is um not working. Any other innovations that we know or have seen? Mine has been, it's more of, it's textile, but it's also because it's mothers in this indigenous group that weave here in the Philippines. I've seen that. So they employ mostly mothers to create these bags and some other textiles, earrings, things like that. And it's really cool because it provides some income for the mothers in that indigenous community. So that's one that I've seen that's very exciting. So hopefully if you want to share more, there Tessa's shared one. There's personalized tools for monitoring pregnancy through a group called AMA. Great. If there's others that you remember throughout the session, you can share it in the comments, but thank you so much for joining our mentee. Just a quick introduction. I think I didn't get to introduce myself. I'm Rod. I'm the community choreographer at Pollinate Impact. I'm from the Philippines. And just to give a quick overview of Pollinate, although I think most of the people in the room are our members, so Pollinate Impact is a member-led network of impact incubators and accelerators in the global south. We have presence in South Asia, Southeast Asia, and Sub-Saharan Africa. And if you do have any referrals for us to join the network, especially for our members who are here, we do offer discounts. So Additif, we can share that on our screen, the QR code. So thank you. So you can get 10% off your membership if you're able to refer to us any incubators or accelerators that you know who might benefit from being part of the network, where we're able to regularly engage with donors and ecosystem support organizations and understand funding priorities. All our members receive a weekly list of funding opportunities, as well as support and concept ideation and proposal review through our office hours with our partner Assist, as well as access to shared tools and resources, and are able to learn insights just like today for our session. Um, all right, I think we are good. I've introduced myself and Pollinate, and now it's time to get to know our speakers for today. I'm so happy to have three brilliant ladies and who have a wealth of experience when it comes to maternal and reproductive health innovations through their support in their incubators. So I will give them the floor to introduce themselves, who they are, where they're from, what organization, and then what they do, as well as a fun question that I've had them kind of prepare, which is what's something you've learned about care, either giving or receiving it, that stayed with you. So let's start with Priyanka. Priyanka.
Hi, thank you so much. So I am Priyanka. I'm from India. I'm based in Bangalore, southern part of India, and I work for Villgro Innovation Foundation. Um, and what I do here is I help the startups working on healthcare and provide them support on incubation and market access. Um, the question on what I remember about care, receiving or giving. I think since we're talking about maternal health, and my personal experience also is it's not just the medical care or clinical care that we provide, but it's also the just being there, listening. Simple act of respect is very empowering. And I want to quote something from my own personal experience. When I was pregnant, and I used to go to this scheduled visit to my doctor, and I used to have a list of questions which at that time were very important to me, and now it sounds very stupid, but questions like what should I eat, what should I exercise, and this and that. And she used to listen to me very patiently and answer all the questions. And next, from the next visit, actually she recommended that I prepare a notebook, and so that she could go through all those questions and answer. So I think that that's something that I remember even now. Respectful and care, and just her act of being there with me during my journey is very important.
It's great. Thank you so
Yeah.
much, Priyanka. Definitely like listening, respect, not judging, especially when people are still trying to get to know this next stage of their life. So definitely a great kind of show of care for you and for mothers, expecting mothers. So awesome. Thank you so much. We'll move to Marushka.
Hi, everybody. So my name is Maroushka. So I'm based from the Philippines, working under Villgro Philippines, similarly to what Priyanka is also doing. So we do provide, we are a gender smart incubator, we mainly focusing in Southeast Asia. We do provide capacity building and technical assistance to a lot of marginalized communities and support through our verticals, which we focus on 5 different key aspects, which is climate, health, gender, impact investments, and education. So how I resonate with Rod's question on care is a little similar to with Priyanka, but I like to use the word empathy. That's what sticks with me, mainly because if I'm looking at it in the work that we do, you will not be able to kind of feel or generally experience their experiences, right? But if you empathize with them and you try to put yourselves in their shoes, you get to see what their pains are, what their gains are, what are they going through, and honestly, kind of really seeing that and trying to understand that makes you help them in a better way rather than being kind of disassociated. So it's kind of human centric. That's what care for me is about. Thank you.
Awesome. Thanks, Marushka. Definitely empathy is definitely like one of the foundations, right, of care, and it's very important when especially in topics like maternal and reproductive health. So definitely agree with you on that. And last but not least, Keisha.
Hi everyone, my name is Keisha. I'm originally from Sri Lanka, but I've been working in Cambodia for the last 6 years. The bulk of that has been with what was a social enterprise called She Investments that has now been integrated into IDE, International Development Enterprises, which is an international NGO operating in 12 countries around the world. So I'm really excited to be here, particularly because although we're a sector agnostic incubator that focuses on gender inclusion, my background is in health policy, and so I'm excited to participate for that reason. And that's enough for now. I'll get into more of that later. But in terms of care, I would say I'll take a bit more of a stance on this from a professional perspective, is I feel like there are not enough employers that care about care. And so that's what I'll leave you with for my thought on that question.
That's a really good point, and I think something that we can process and digest while we get into the speaker insights for today. So I'm really excited for our speaker lineup today and what their experiences are in terms of supporting enterprises within the maternal and reproductive health industry. So without further ado, we'll start with Priyanka from Villgro to share her insights and experiences.
Okay, I quickly share my slide deck.
No worries.
Okay. Okay, let me know if you can see it.
Yes, we can see it.
Okay. Great. So I would like to start by this quote, and it's very inspiring, and that's what we all are working for, right? That a world where no mother dies while giving birth, and every child gets a healthy start, right? And not as a dream, but as a reality by infusing more in bold innovations in this segment, and also improving the access of these healthcare services and innovations to the people who need them most. Uh, so very quickly about Villgro. So as I mentioned earlier, Villgro is a non-profit organization started 20 years back, one of the India's oldest incubator. And our approach to support the enterprises, there are two different approaches that we have. Is incubation support, which traditionally means that we provide technical assistance along with funding and hands-on, customized approach to different aspects, starting from R&D to GTM. And then the more recent approach, which is now evolving, is facilitating the adoption of these innovative solutions into the market through building market partnerships, um, and also providing them with innovative financing models like blended finance to the innovators and also to the end users. And this is the journey. I mean, we've started, in fact, our first few enterprises that we started supporting into maternal health in the healthcare space were from maternal and reproductive health innovations. So far we've supported 90 enterprises, different spectrums like MCH, SRH, mental health, and non-communicable diseases. Um, so what I would like to talk here is that this tremendous progress that have been made into maternal and reproductive healthcare space, especially on the reduction of maternal and infant mortality, but there's still some gap in terms of access to the services, to the last mile care, especially around monitoring and diagnostic type of solutions, or access to the healthcare providers who can guide the patients throughout the journey. Uh, and in last few years, some of the trends that we've been seeing into this space in terms of innovations are, there's a rapid growth of tech-enabled point of care type of solutions, type of innovations, which are portable in nature, point of care, and also provide the remote monitoring solutions. So For example, a portable fetal monitoring device, which can be taken anywhere, even in ambulances, and the fetal monitoring can be done there. Also provide the regular, continuous monitoring. There's also a trend of AI tools which can predict the risk category for the patients, so that it also works like a triage for healthcare providers, so that they can focus on priority cases. And because there's always a gap of available healthcare providers versus the number of patients. So these kind of solutions are in trend now. Another category which we are seeing is digital platforms and telehealth consulting platform. I think somebody mentioned that the innovation that they found very interesting was within this category. So these are the kind of solutions which are making the healthcare accessible from anywhere. And one of the enterprise that we are currently supporting, named Pinky Promise, they provide the consultation, the availability of gynecologists on their digital app. So these are the kind of innovations which are really making a dent in the low resource settings. The third category, which we are seeing right now and very important, needed, is the menstrual and sexual health innovations. So starting from fertility tracking apps to contraceptive family planning tools access, eco-friendly menstrual hygiene products. These are coming up. And Villgro actually, in fact, supported. We've recently completed two cohort of the program called Yash, where we supported 18 startups who are focusing on bridging the gap of access of menstrual and sexual health innovations. And these included, eco-friendly menstrual hygiene products, reusable cloth pad to, the cup. So some very cool innovations in this category. And the last, what is in trend, and not the kind of innovation, but innovation in the category of service delivery, the way these innovations are actually delivered in the last mile care. And that's mainly towards building a community access platform, where the frontline workers or health entrepreneurs or volunteers are trained to take these innovations or services to the last mile care at their doorstep. So this is the trend which we are seeing. Um, to continue to talk more about the market access bit, which is in addition to the incubation support that is provided to the healthcare innovations. It's basically to help these innovations to scale further into different market segments, refine their business model, refine the use case of their product for in a particular geography. And that's is coming up significantly. A lot of incubators and accelerator are working to streamline this process of building market partnerships, building an ecosystem, so that innovations, funnel of innovation can be introduced in these platforms. Uh, uh, this is one of the case study that I would like to share around, how our platform actually helped in bridging the gap of access to the diagnostic healthcare services in one of the districts in Bihar, Muzaffarpur, where the need that we identified was that the rural communities, they face that barrier in accessing the quality healthcare screening services. And what we done is, we identified 40 women from local community. These women were usually 12th grade pass or graduates, and they were trained in basic healthcare concepts, prevention of health, preventive health, and how to identify the danger sign. And also later on, they were trained on different tools. Like here, for example, this was one of the innovations which they developed a portable blood diagnostic device, which actually provided the result of the report within 15 minutes of the test. Easy to maintain. So the CHEs, community health partners, these women were trained to use the device, and then they conducted screening within 5 villages in such a way that they were also, later on also started charging for the screening that they were providing. So in a way also make sure that this platform becomes they're providing. So addressing two issues: one is livelihood, and the second is access to the healthcare services at their doorstep. And one interesting finding, the one of the women who got the screening done in these camps shared that otherwise she wanted to get the thyroid test done, and the closest healthcare facility or diagnostic center was around 20 kilometers away from her home, and going for that screening meant losing one day of their daily wages, leaving children at home, and also spending a lot on the travel, right? But with this, availability of screening facility in their village actually helped them a lot, and empowered her in a way to, understand her health her parameters and then take action on them early on. Otherwise, she would have, delayed it, delayed the screening, and delayed the treatment further. So I think these simple solutions and platforms like the Community Health Entrepreneurs Platform made a big difference in this case. And besides the thyroid test, they, the device also provide multiple tests like hemoglobin, blood pressure, glucose, parameters which are important during pregnancy. Uh, Another intervention that worked really well is the fetal monitoring device. So what happens here in India is that pregnant women, especially in tier 2, tier 3 geography, general physicians are the main point of contact for the care during pregnancy, and they visit the general physicians mostly because the availability of specialist gynecologists is not there, not that streamlined. Um, but these general physicians, they don't have the fetal monitor device, or they only have the handheld Dopplers. What we did here is that we identified a local distributor partner and also the enterprise. They uh, conducted awareness campaigns for the general physicians and did the trial in their clinics. And based on the feedback from these doctors, they actually purchased these devices and started using, which helped them in improving the screening, identifying the cases early on, and then referring the patients to uh, the gynecologist so that the treatment or management can be started earlier than and they can avoid further delay. So that's another case study, how these innovations are actually making a difference at the last mile care. Uh, Coming to some of the challenges and opportunities in the maternal and reproductive healthcare space. So I think because there's a lot of AI and digital health apps and innovations are coming up. There's still the ambiguity around the regulatory compliances, especially around AI, and what kind of certifications are required for that particular technology. to manufacture and further say sell the device. So I think that's ambiguity still there, and that's a challenge for the innovations. And then the second challenge is around the long cycle of adoption of these interventions into the public health system, and also the low resource settings. In terms of opportunities, as I mentioned earlier in my slides, that the specific targeted GTM support to the enterprises, to the startup on refining their business model and refining the use case of the device and intervention uh, is needed. And also support in developing hyper local transformative model like the community health entrepreneur model, which is more sustainable in long run, and that really can make a difference. That's another case study. I'm not sure if I have time or not. Maybe I can
You
talk
have
about.
about a minute, Priyanka. So if you wanna,
I think
you can.
can I think I'll skip this.
Great.
Yeah.
Okay. Well, awesome. Thank you so much
Thank
for
you so much.
what you shared. That was really great. I think something that I took away from it is how important, especially when it comes to working with communities, right? And that's where, you know, more impactful change can happen, where if we provide access, for example, to screening and diagnostics for them and be able to teach them to do that, then it creates this ripple effect within the community so that they're more aware about different conditions, and they're able to learn more about maternal and reproductive health, really. And that's through championing these community health entrepreneurs. And it's such a great case study that I think we can all learn from, a great approach. And I'm really glad that you were able to share that experience. So thanks so much. We'll move to Maroushka, Villgro Philippines, to share their insights.
Hi again, everyone. So I won't be sharing any slides, just be speaking to you directly, but I do have a tool that I'd love to share with everybody in this call later. So from Villgro, really, we really had a great opportunity of being one of the forerunners, incubators within the Philippines to create a longer term program for sexual reproductive health and particularly for neonatal and maternal health. So that was when we started the Reach Health Innovation Program, which that was actually a 5-year program in which we ran it for around 3 years, along with USAID and the help of Duke Health and Science department. So how it initially started was it was a hackathon where kind of we were able to gather a lot of different people who were active in the space to kind of jump in and talk about their pains and gains within this sector. So that's how it kind of all started, and that's what brings us to our journey here at Villgro Philippines, where we kind of provided that support in terms of how what it is happening here and what did we learn from that consortium of learning from people is that unfortunately here in the Philippines what's happening is there has been this wonderful news. There has been a decline in teen pregnancies from the ages of 14 to 19, but there has been an increase in pre-adolescent pregnancies from 10 to 14 in the past few years. And it kind of sparked more conversation post-pandemic, especially with the kind of environment that we do have now. But with that, that's where ideation and kind of like people who want to solve this problem comes in, and mainly what I wanted to share as a key success in the programs that we've really built is that we really ensured that we were also grassroots and kind of really leaning towards what these enterprises were able to build and solve. An example. So one key example of that would be Yaka. So Yaka is or it's actually a play on words. It's Yaka.ph. So Yaka, um, in an urban language in the Philippines, when you say Yaka, it means you can do it. Yakang yaka mo to. Kaya mo siya. You can do it. But when you put a P at the end of Yaka, it's actually meant as a hug. So it's called Yakap. So what they did, it was actually from that hackathon. They built a digital baby book to provide mothers, especially from like very low income households, to have for them to have a digital baby book, because in the Philippines we all start with this small pamphlet booklet. I don't know, Rod, if you still have yours. That's where we all start, where our parents would really write down everything. We are the size of a fruit, of like of a calamansi, of a mango, ultimately a papaya. That's how they did it. So that's how they iterated it. And they knew that a lot of Filipinos were very much to their gadgets, into their cell phones. So we have more phones than we have toilets in our households. So a wonderful story came out is that, hey, this is a better opportunity for us, for these people to create a solution that can help them really build up their child's growth, uh, and for them to be supported because it was kind of like an app that not just only provides a digital baby book, but it did have access to teleconsulting, also to where are the nearest clinics, especially in the outskirts and the provinces. So that's where you really see the excitement and innovation that happens within these. And from that, a lot of it really did kind of revolve around of teleconsultation in the first iterations of the hackathon, which ultimately we saw the challenges in a way that we know the Philippines is really, really, really early stage, maybe as not compared to the peers that we do have in Southeast Asia. And more often than not, entrepreneurs are I wouldn't say disheartened, but they have to kind of weigh their options on whether they want to provide impact first or look for profit first. Because there's such a short runway. There's such a short runway. It's so difficult for them. And the main key things that we really back ourselves on when we tried to support them was making sure that they have the regulatory backing, the information that they need to start this, because it would be all for nothing if they start on the wrong foot. That's the kind of support that we as incubators really do within the space, is to capacitate them and let them know, hey, we can connect you to these regulatory boards, to these local government units, to provide that support and that validation that you will need to proceed to the next step. Because and also with that, kind of going back to how we spoke about care earlier, as we empathize, how do we learn as incubators when we provide this support is, um as I shared with Rod and Keisha and Priyanka, is that we've had several experiences as well where companies have pivoted from their original ideas, and it's very disheartening for them, for business owners or enterprises or entrepreneurs who have this big idea in their mind, the goal to ultimately get to where they want. But what if it's not working? So, as an incubator, or as an accelerator, or as those people building that capacity, giving them or capacitating them, you also have to remember to hold space, to understand that um, shifting or understanding pivoting needs um is can or is really necessary for you to survive in this kind of environment, and to also help them understand that you are not trying to lose your original vision, but really reframing your solution with evidence-based decision making and not just the outcomes. Even if you failed several times, it only just takes one success, right, to push you and to propel you forward. So I will stop there. I do know we have like a panel discussion later. But I'd like to share you one tool that we really created within Villgro Philippines, and the help of this program, this Reach Help program, is it's called the Innovation Playbook. So do let me know if you're able to see my screen. I'll just share that shortly. Okay. Okay, is everybody able to see it?
Not yet.
Not yet. Okay, hold on. All right. Okay. So this kind of boils down all the learnings that we received. And we kind of made this handbook for incubators, for health incubators particularly, within the Philippine ecosystem, within the Philippine space. So this really talks about how we faced government and regulatory challenges, what are mainly who is it for? We really created this tool for local government agencies to incubate incubators. So it's because they know what they're doing within the government, but they don't really have the mobilization or the enough people to propel it forward. So inside this playbook, we really created case studies as well to inspire those hackathons to really bridge conversation on how to make these solutions, and ultimately, are they good and well enough to go into incubation and acceleration? Either it's within Villgro, either within other incubators who want to make these programs, and ultimately the importance of also post program support and investment. So I'll be sharing this link to Rod and also to you in the chat. Really talks about the whole startup life cycle in the SRH and maternal health context. It could it's in the Philippines, but I do know that it will help this because a lot of it really does kind of revolve around regulatory work and how do we kind of work with that. So that's me on my end. Thank you everybody. Thank you Rod for this opportunity. On to you.
Thanks, Maroushka. And that was such a great resource. And I think wherever you are in the world, it's a great start, right? Even if you're not from the Philippines, I think it's a great kind of review because maybe there are some overlapping regulatory frameworks that are like exist in the Philippines and are also, let's say, in Southeast Asia or even in India or in Sub-Saharan Africa as well. So thank you so much for sharing that resource. And I think something that I really enjoyed about what you mentioned is, being able to deepen the relationships with the entrepreneurs you work with, also because it helps you understand their realities and the realities of the people that they work for, their stakeholders, as well as in times when there are challenges like pivoting, right? Because if we all know entrepreneurs, they're really quite personally connected to their business, and a pivot might also mean kind of an existential crisis for them. So being able to support them at that time as an entrepreneur support organization is definitely essential, and it really provides the care that they need at that time. So thank you for sharing that, and we'll move on to Keisha.
Hey, thank you. That was super interesting to hear the stories from Villgro Innovations and then also Villgro Philippines. I'm coming at this from a bit of a different angle. We've also worked with enterprises that are providing health services and technologies, but because we've kind of shifted our focus in the last 5 years to focus on more rural and peri-urban enterprises rather than urban ones, I'm actually going to talk a little bit more about entrepreneurs accessing the services of other entrepreneurs that provide health services and technologies, if that makes sense. So going a different bit of a different level. So in terms of what we do, so She powered by IDE, our goal is really to build a gender inclusive ecosystem that enables entrepreneurs to scale their business, but also to create economic, social, and environmental impact. And it's not just impact, but being able to access those essential parts of being part of the world. And we're actually just celebrating our 10-year anniversary this month. So it's really exciting that we've been around and that we've been able to provide these sector agnostic incubators to enterprises that are engaging in a broad spectrum of different areas, but also for the specifics of this discussion, those in maternal and reproductive health, including those who provide general health services, women's health, and then also those that engage in the provision of period products. And then as we're part of IDE's global structure, IDE as an NGO focuses more broadly on sectors like wash, agriculture, nutrition, clean cooking, and the garment sector. And what we do is we take a market systems development approach. And this means stimulating the entrepreneurial ecosystem, working with businesses to innovate products and services, and then providing them with the support necessary to have those innovations reach market. And so with that in mind, and also because I'm a bit of a policy fanatic, as I mentioned in my introduction, I'll start with a bit of context in terms of Cambodia and what maternal and reproductive health looks like. So Cambodia has made a lot of progress in this space. There is a huge a huge increase in maternal and child mortality, but this still remains a concern in the country, often because of challenges like lack of access to information. So although there is great digital infrastructure, at the rural level, it's often hard to receive that information, even though smartphone proliferation is high. Things like data signal and signal strength makes it very difficult to access still. Financial barriers are a huge concern for every sector. And there's often an issue of service provision. So is it convenient? Does it reach the rural household? And then generally, there is also social cultural norms and fear around side effects that you might have from birth control. So there are lots of women that are seeking maternal care in private facilities, but there are often challenges with public facilities. And there is a big discrepancy where you can see it in terms of receiving antenatal care during a pregnancy. There are significant differences between those who are utilizing public and private facilities. So Cambodia has a social security scheme called the National Social Security Fund. And this provides free healthcare services to those that are deemed ID poor. So those who are under the poverty line, which is approximately 17% of Cambodia's population. And then there's also those who can access NSSF as an individual. So I'll talk a little bit more about that later, but there was a partner who was part of a USAID-funded program that existed in Cambodia a few years ago that was advocating for individuals, like individual entrepreneurs, to be able to access that National Social Security Fund, be able to make in their own payments, because historically it used to be employers only that were able to facilitate that activity. And so this has increased a lot of access for individuals and has started to cover more of the population. And they've also added a retirement scheme in there, which is quite interesting. And that National Social Security Fund is actually what provides paid maternity leave, which was introduced a few years ago, and that you would receive 70% of your salary for 3 months, which is the amount of time given to you when you are having a baby. But unfortunately, this is 70% capped at $300 a month of salary. So if your salary is higher than $300 a month, that's rough. Depends on the exchange rate of the Khmer Ringgit. You're not able to receive more than 70% of that number. So that's one of the challenges in this space. In terms of our programs, so they are sector agnostic programs, but some of the learnings here, I think, are valuable for these health-specific programs. And that's why we've been able to continue running these sector-agnostic programs quite successfully, is even though there are several different enterprises, usually when we conduct those skills assessments, we find that they're still the same kind of core challenges. So I know that there were a few summarized already, but some of the core challenges for these businesses in any sector include financial management, marketing, business revenue diversification, team management, and then in Cambodia, the registration and taxation issue as well. So one thing that we try to do is we look at how can we support these programs and how can we help them generate the revenue that's necessary by working in these different areas. And typically when we work with enterprises, we ask them, what are the top 3 things that you would invest in once you are able to generate more revenue? And they say health as one of their top 3. So we know that that's a priority for them in terms of being able to use those services and access them. So because we're focused on building agency, our idea is that we also need to transform institutional structures and enhance access to resources. And so when we're working with these rural entrepreneurs and empowering them to pull themselves out of poverty, health is a really important part of that in terms of access to both maternal and reproductive health, because we're working with 90% of our participants are women entrepreneurs. And so we're trying to do things in our programs. We see entrepreneurship as the vehicle to increase decision-making for both for their finances and the household. being able to pay themselves a salary so that they can pay for those antenatal visits, and then as a cohort, be able to take collective action. So we've actually seen that one of the enterprises that I've submitted as a case study for the activity that will happen later in the call, she actually is driven by providing affordable maternal and reproductive healthcare services. And through the network that we created in our program, a lot of her customers are other entrepreneurs that have participated in our training, mentoring, and coaching. Because we're also trying to change social norms, a lot of the women entrepreneurs do talk about taboo subjects like financial management when it comes to childcare, being able to save up money for the birth of a child, being able to afford health and social care services. And so by changing those social norms, we're seeing that the value of entrepreneurship as a means to access resources in this space, there is a direct correlation. And so we try as much as possible to generate some evidence and improve critical consciousness, as well as provide access to assets and resources. So one of the things that we do in our programs is, like I was talking about, National Social Security Fund, is that we actually facilitate for the enterprises who are part of our program to receive information from that fund and facilitate direct access for them to register, because a lot of them aren't aware that they can actually access that service. And for example, in some of our WASH programming, we work with latrine business owners who are providing toilets to different communities. And we actually, alongside that with the sales agents that support them, we train them on education related to menstrual health and hygiene, so that then latrine business owners are aware of this information and can also share that with potential customers that are buying their products and services. So although we don't have specific verticals, we've integrated this idea of sexual and reproductive health into different facets of the kind of programmatic work that we do. And because we've taken this approach to being gender inclusive, we're also trying as much as possible to encourage the enterprises we work with to do the same. So for example, we'll work with enterprises to develop gender equality policies, which often include commitments to increasing the level of paid maternity leave, providing period leave, and also increasing things like paternity leave, which is much lower in Cambodia than maternity leave. And so some of these changes, we also start to see more of these enterprises starting to care. And that's why earlier in the section when we had the prompt about care, for me, a big part of this from a policy perspective is also educating businesses as much as it is about the business training and revenue and scaling. For us, it's so much as well about improving that agency, and also as a business, walking the talk in terms of how you extend that within your own business and outside of the community, outside to the community. So in terms of what else we do in this space, we also often engage with other private insurance companies just to provide diverse services that might be available, so that then when entrepreneurs do generate more revenue, they can have access to private healthcare options that give them larger access to other needs, and often more higher quality care options as well. So in terms of best practices, I would say for us, just because I've been quite sector agnostic in this, it's really just to understand what entrepreneurs really need. So listen, whether that's something related to what they need as an enterprise to make their team feel supported when it comes to maternal and reproductive health, or being able to access it themselves as a consumer, or increase the provision of access for their customers. Facilitate networks, because any of the enterprises that you incubate might be providing services to other enterprises that you incubate, as well as the wider community. And then where possible, try to work on the existing systems that are in place. So for us, that looks something like engaging with existing government schemes that can often provide more sustainable and cost-effective ways to access healthcare, because that existed and it was possible for us to integrate. And then where possible, try and engage the private sector when it comes to the provision of private health services as a value add to those public services. So I think I'll end there.
Thanks so much, Keisha. That was really great. I think it provided a different perspective on what maternal and reproductive health innovation can look like, and also put kind of a focus on incubators and the way that they support maternal and reproductive health for all their entrepreneurs, right? No matter what sector you're in, there is a way for us to promote this, especially for those who um, also want to increase the amount of women-owned businesses that they support. Then this is also, these are ways that we can offer that support to them. So thank you so much to Priyanka, Maroushka, and Keisha for sharing their experiences and insights. We'll now move to a short Q&A. So if you have any questions for our speakers today, you can feel free to raise your hand if you want to ask it, or you can also comment it on the chat, and then we can ask the question for you. Just let us know. Um, yeah, maybe while we wait for others to think of their question, I have one that I'm curious about. In with public health systems, my experience here in the Philippines, it tends to be sort of closed. Like the access to it tends to be not as great for those who aren't part of the public health system, right? If you're not a doctor, if you're not a nurse, if you're not a technician within the health space, there's a challenge of access for the regular person. And I wonder, as entrepreneur support organizations, as incubators, how do you navigate around these challenges? Do you see any opportunities in your own public health systems that help you partner with them, collaborate with them, and to help entrepreneurs reach those public health systems? Yeah, any of you can start if you're ready.
So
Priyanka,
I can
yeah, go
I
ahead,
can go.
and then
Uh,
Marushka.
yeah. So although it's a big challenge for innovations also to get the procurement from the public health bodies. Uh, what we have been doing, the way we are facilitating is building microsite evidence on which will establish the utility of that innovation in that particular system, right, or setting. And that evidence can actually justify the government or the public health authority to decide how much budget to allocate, what would be the impact, and the cost effectivity of that innovation. So that really helped in to some of these innovations in establishing that evidence, and also getting the procurement from the state level or district level hospitals.
I think that's a great idea. Like it's a proof of concept, right? So that it proves to those within the public health system that it actually works. The challenge there, I guess, is funding, right, or budget to actually put up the infrastructure. I'm sure there are ways to navigate that if it's a micro site, but again, I guess that's a consideration, right, for the incubator when they do something like this. But definitely a great idea. Thank you, Priyanka. Marushka, you had your hand up. Please go ahead.
Yeah, so one experience that we did have was for pilot testing with one of the entrepreneurs that we supported. So what we were able to do was kind of leverage health programs of each LGU. It's kind of a thing here in the Philippines where programs are also vetted. So if there's more support from the mayor or the LGU, then it kind of gets passed if there's like a proof of concept. So what we did is we tapped local governments who are more open to these kinds of testing for them to try that innovation. So this innovation was actually born out of the pandemic. We used to have these SMS messages where, hey, you get your next vaccine shot, your anti-COVID shot. So this worked as an SMS for taking as an SMS reminder for taking your pill, your daily pill. So and of course that had to have a lot of like infrastructure with telecommunication lines, like how much would a text message cost, right? So then we did partner with these LGUs who were able to kind of back up the entrepreneur who wanted to test this out, and in small communities first. uh we tried to go for dense densely populated communities with high pregnancy rates, because they were really much more open to that, and to ensure that there was a, what do you call this, it's because there are not a lot of officials that are stated within local government units, um, who are constantly there. So it's like if there's one local doctor, he travels along across the whole region. It's not like one doctor to one local government unit. So we had to ensure that there was one practitioner there who was able to kind of support the process and help kind of vet this program also. So maybe that's a key consideration for you to try if you're going through these partnerships, is to ensure that you kind of go through the low hanging fruit. It might look as simple as that, or it might sound as easy as that, but sometimes it isn't. Sometimes it's just staring at you right in the face, and all you have to do is ask, or be a little bit more kind of um what's the term in English, word makulit.
A bit more, how would I, what's what call it? Like, persistent.
Yeah, okay,
Yeah.
persistent.
Yeah.
Thank you so much.
Thanks, Maroushka. Yeah, no, I think that's a great idea also on leveraging local government unit support. Because it's an easier ask versus like the whole department or ministry, right? You're focusing on one community. And especially if you have a network where you're already connected to the mayor, the governor, whomever in that place, then it might make it easier for you to implement the venture or the enterprise there. And at the same time, there is budget. Like, well, in the Philippine context, I think a lot of the budget is being held by local government units. There's even 5% that's allocated to what we call GAD, which is gender and development. And I think this should fit, right? Like maternal and reproductive health somehow should generally fit in that category. So I think that's a great idea to leverage connections within local government units. Keisha, do you have anything you want to add? Yeah, go ahead.
I would say, yeah, for us, that's been quite the success, being able to engage with those existing local entities. And it was something that we didn't realize at first, but I think that speaks a lot to the collaborative nature of the ecosystem. Because there was that partner that facilitated it, we were then able to use that and amplify it. So I think that's part of that ecosystem development piece, right? Just because it doesn't feel like the most naturally aligned thing, as soon as you start to speak to entrepreneurs and you understand that, especially in our case for rural enterprises that are starting this for subsistence, they're just doing it because they want to be able to pay for their family's welfare, for their health, their education. And so if you're able to create opportunities to facilitate access to those services based on the needs that they have, then of course it's going to work well. So that's what I would add.
Yeah, contextualizing it is very important. Thanks, Keisha. We have one question here from Carol for Priyanka around the cardio tokogram. If it's done remotely, the monitoring, or the patient has to go to the center. I think she just wanted to clarify. Yeah.
Uh, So in this pilot, in this project, the patient, they have to go to the clinic uh, for the whenever they are going for the regular checkup, they also get the fetal monitoring test done. But the enterprise also has a portable. I mean, this is also portable, but they also have a kit which uh, goes to the community, and the community health entrepreneur actually apply the device on on the expectant mother, and then the test is done and the reports are sent to the doctor or the healthcare facility which is connected to this whole network. So,
Awesome. Thank you.
yeah.
Hopefully, Carol, that answers your question. One last question before we go to our activity, and if there are none from the group, I have one last, and it is, what's one bold idea you think the ecosystem should rally around to support maternal and reproductive health innovation? So By bold, I mean maybe something that hasn't been an unpopular opinion, for example, or something that hasn't been shared yet. And by ecosystem, I mean not even just incubators, right? Like as the whole ecosystem, are there other players that might want or need to contribute more, or in other ways? So if you have any of those bold ideas, please go ahead.
I
Keisha?
can go first.
Yes.
So not necessarily in the health space, but we've been seeing this pop up a lot in the Cambodian context for other types of enterprises, is we've actually seen a lot of women-led group enterprises. And so they're taking their own individual expertise and doing things like, of course, agricultural cooperatives are a huge thing here, but we've also seen more of our enterprises doing things like it was women who were selling fish, fermented fish products and dried fish that were within a kind of community ecotourism area, and they started diversifying their products by doing handicrafts. They started to create their own community-based ecotourism site offering all of these different services. And so I think this is something that could lend itself well to the maternal and reproductive health space as well, just in terms of being able to amplify scale, being able to keep services and products affordable, reducing overheads. So that's the kind of thing that we've started to see. There's more of a trend in Cambodia for rural group enterprises. And so this might be interesting, something different.
Oh yeah, that's a really interesting thing to think about. Maybe something that we can introduce in other parts of the world. Something to consider, definitely. Thanks, Keisha. Maroushka, Priyanka. And then I'll go to Dr. Amos, who might have a question for us. Yes, Maroushka, go ahead.
I think it's also been a kind of like a growing thing that I've observed is like also giving um, collaborative partnerships with male organizations to actually provide reproductive health awareness education campaigns because it's mainly been focused on women or um, where I think there is still that stigma here in the Philippines where women or mothers or um, childbearing individuals are the one who are responsible for the kind of care that have to be aware of parenting duties or responsible reproductive health, but it's a basic human right. So I think that's also something that could be a shift or hopefully could be a cultural norm in the near future. The norms around masculinity and reproductive health, and also understanding it to reduce gender-based violence. That's one of the main things that I also want to hopefully see as a bold idea.
Oh yeah, 100% agree. The involvement of men in this discussion, right? I think it's definitely now including more, but it could include more of men in this discussion because right, there's more understanding in the women's communities about reproductive and maternal health. But now also how do we include men in that mix, especially when it comes to parental support and even in reproductive health, right? There's a lot of burden that women have to carry when it comes to reproductive health. And if it's shared, then the burden becomes much less. So definitely a great point. Thanks, Marushka. Before I go to Dr. Amos, I'll go to Priyanka on her bold idea.
Um, so I think this whole idea, whenever you talk about maternal and reproductive health, it's a niche category. It only impacts women and children, right? Uh, how do we start the conversation that it affects, other segments as well? Because if the women do not get right care, child doesn't get right care, it's not a good start. So start treating it as a you know thematic agnostic, or I don't know what to call it, but I think we need to start talking about it more and more rather than just treating it as a specific segment. Yeah, that's I think that's what we need to start.
Really great point. Like seeing it for the big picture that it is, right? Like maternal and reproductive health is not niche because if we're able to take care of maternal and reproductive health, then productivity increases. Then women don't have to worry about child support, things like that. So definitely it shouldn't be a bold idea, but I guess right now it still is. But definitely really great points. Thank you so much. I'll go to Dr. Amos. Dr. Amos, did you have a question or an insight? You're on mute if you there.
Yeah, thank you so much.
Mm.
I've been following your discussion, so I came in late from another meeting. In the view that reproductive and maternal health is an issue that's a global concern, and there are so many obnoxious cultural beliefs that are really affecting the implementation of these best practices. So I am suggesting, in line with one of the last speakers, that this reproductive health and maternal issues should be included in the curriculum of schools, especially from secondary school, higher institution, because it's a serious concern, and many people are not aware. And there are so many bad cultural beliefs that are affecting it. So I'm strongly suggesting this should be part of the training curriculum, secondary school, high elementary schools, and higher institutions. That would go a long way helping the world. Thank you so much.
Thank you, Dr. Amos. Definitely.
Thank you,
Again,
Dr. Amos. Definitely. Again,
something that shouldn't be a bold idea, but is right now to include reproductive health in curriculum. In the Philippines, supposedly it is now in law, in our law, that reproductive health should be discussed. But again, because of religious concerns and more conservative beliefs around reproductive health, it seems to be it's not as discussed as extensively as we would hope, so that there's more discussions around it, but definitely agree that it should be more of an open conversation so that we avoid a lot of unintended harms that could be avoided just by learning more information, right? The access to information to reproductive health is definitely very important in this discussion. So thank you Dr. Amos, for sharing that. And now we will go to our activity. We will do it as one whole plenary because we are a small, intimate bunch today. Aditi or Madhura, if we can bring up the slides. We will do our healthcare incubation challenge. So for all of our healthcare state of play series, we have an incubation challenge where if you can go to the next slide, please. Step into the shoes of an incubator. Most of us here are part of incubators right now. And then we decide how to support, sorry, it shouldn't say mental health, it should say reproductive and maternal health startup. And what we'll do is we'll analyze it for a bit, maybe not 10 minutes. We'll give each other maybe 5 minutes. We'll read it together. And then we'll consider these questions if we're going to support these enterprises, right? Does the venture address real pressing healthcare challenge? Is the solution innovative, scalable, impactful, and sustainable? What barriers might it face? And then what support, if ever, would your incubator provide? So we won't do the pitch since we're a small group. What we'll do is just get insights from everyone, what they think in terms of this certain venture that we're presenting as a case study, what would be some challenges that they see, and then what support would our incubator as one plenary right now provide this certain venture so that they're able to thrive and scale. All right, so let's go to case study number 1. Okay, so I'll read it out. Case study number 1 is FemCare. It seeks to be the leading provider of women's health services in Phnom Penh, providing high-end maternity services to a middle-class market. It's founded by a solo female entrepreneur with expertise in obstetrics and gynecology. The venture provides services on general medicine, antenatal care, infertility, cervical cancer screening, vaccination, breast cancer surgery, medical imaging, and various other services. It has received support from various incubators in the form of training, coaching, and mentorship to learn more about creating a business plan and financial management, and won a grant to support essential equipment purchases. Some key considerations include that there's a solo female founder with OB-GYN background, focuses on a broad range of services related to women's health, has participated in several programs. It has a clear mission and value proposition. And then the challenges right now include team and financial management. What do we think of this case study, this venture? Does it look like something that addresses a concern? Does it look like it's scalable, impactful? And then what barriers do you see, or what support would you give if you were an incubator? So I'll throw it out to the audience. You can unmute anytime you'd like and give your thoughts. Yeah, Esther?
Yeah, hi everyone. So I think my thoughts on this are I do like the wide range of services that they are offering. My concern would be the target to just a middle class market, and I am from Villgro Africa, so from what I've seen in our ecosystem here is that when you target, for example, like a middle class market, in our country, for example, this is a persona who is not limited in the options that they have, especially to access these services. They probably have good insurance when it comes to, and it's covered, these services are covered under those. So I'm worried about the sustainability long term and also the scaling. They're just focusing on one particular market. For me, my advice would be to explore a business model whereby even though they have to probably just have various packages for different markets, I think that would really help with long-term sustainability and even scaling within the jurisdiction that they are working under. Yeah, thank you.
Thanks so much, Esther. Really great points. Anybody who wants to add on to what Esther said or maybe disagrees? None for now, but I really like the point around focusing on one market, right, and sustainability long term and scaling, because then you're very limited to who can pay for your services and who can access them.
I don't know if we're allowed to, but since I
Yes, Keisha,
submitted a
please
case
go
study,
ahead.
I just want to say that so this entrepreneur has actually diversified their market and as a result is more financially sustainable. And also was able to provide a wider range of services, including general health services as well. And so that's helped with the business model. So Esther's advice worked.
Awesome. Thank
Thanks,
you.
Keisha.
Thanks, Esther. Thanks, Keisha. Any last thoughts or ideas for this certain case study from the group? We have Gabby, Momo, Ida, Mega, Fieldy, if any of you have any thoughts. Dr. Amos also. All right. If no
All right.
other,
If
yes, Dr. Amos, go ahead.
It's the occupation type of entrepreneur engaged by women actually to affect behavior, which we need to focus on gender-friendly innovation to engaging women. And that will require some level of information awareness creation. If there are, like in Niger data here, There are cases of abuse resulting from use of alcohol. People opening beer parlor, alcohol, or doing hard work, doing concrete work, and all that. So we must take note of type of gender-friendly enterprises that are suitable for women's health, which is very, very necessary. That's just my
Great.
Great.
Thank you, Dr. Amos.
Thank you, Dr.
Yes,
Amos.
Ida?
Thank you so much, Rod. Okay, for me, the value proposition is the most important key because the services provided could be provided by anyone. But what differentiates this business or company from the others? Why should someone go to Femcare as opposed to any other of the thousands of healthcare providers? So once we get a good idea of what that value, what added value is someone getting, that will differentiate her. And someone might actually choose or select to go specifically to Femcare as opposed to other healthcare providers. Thank you.
Really great point. Keisha, would you like to quickly respond to Ida's point?
Yeah, I think in terms of the value proposition, so because of the really strong background that the entrepreneur has in this space, one of the best things about, because I also am one of her customers, is she has so much empathy. So she's a mom herself, and she definitely leads as like the empathy first, story first. She's very caring, and she's been able to demonstrate that a lot more. So she has made a lot of videos kind of doing online public health campaigns related to educating women about sexual and reproductive health, and men as well, and those that don't identify as men or women. And this has gained a lot of traction. That has also diversified her customer base because you can see her personality, the fact that she is experienced, that she has the lived experience herself. So it's the education, the life, and this has drawn in a lot of people to continue using her services.
That's really great. And I think it comes back to that whole empathy, right, of the care and her being able to relate to the people that she serves. So definitely important. Thank you so much. We'll move to our second case study. Mother Aditi, if we can. Yes, for Care Mother. So Care Mother is a medtech enterprise focused on enabling monitoring of vital parameters during pregnancy via integrated digital platform and connected devices for urban and rural populations. The company is led by a dynamic founding team with strong experience in medical diagnostics and technology. They aim to improve early detection and pregnancy monitoring. Key considerations: the founding team has expertise in operations and tech-led service delivery, focus on pregnancy monitoring interventions to early identify danger signs, clear value proposition centered on accessible, convenient, and tech-enabled health services at home and the hospital. And then some of the challenges include expanding partner networks and scaling operations without diluting service quality. I'd love to hear from the group. Any thoughts, insights on this? Yeah, Esther?
We can go, yeah. I'm really a big fan of medical diagnostics and devices, especially that are targeting the low resource settings. So I think this is a very good innovation. My concern has been, especially with the medical devices, is the market in which they're operating, and I really do not have the background specifically for this particular innovation. But when it comes to our setting, the medical devices innovations, like without the backing of probably let's say, a non-government organization or even the government that is funding or distributing these devices on behalf of. We found like the purchasing power, especially of the facilities or the clinics or the healthcare providers in the low resource settings tend to be limited. So I think I do like the model, but my concern would be whether that is sustainable, or then would they need to establish these partnerships with these other institutions that help in purchasing these devices on behalf of and distributing them. Yeah, other than that, I think I really a big fan of devices that are targeting the low resource settings.
Awesome. Thanks, Esther. So really concerned around, initial infrastructure and whether there's budget for these communities to buy the machines for this in their communities. Um, Priyanka, can you give us a bit of idea on how whether this has already been solved, or how this is going now with this certain case study?
Uh, so yeah, especially ensuring the availability in the low resource settings.
Sorry,
What
Priyanka,
should
you're a little
Can you hear me now? Is it okay?
that's better. Yes.
Yeah. Ensuring the availability of these devices in the low resource settings uh, is actually done through partnerships with NGOs or organizations who are working there. That has been one approach. Second is, of course, targeting the public health institutions who are working in the local rural communities, and then trying to understand how these devices can be integrated into those facilities. And third is what I talked about during my presentation was, creating a more sustainable community-led model, community access platform where local women are trained, uh, and people who can actually afford the screening through these devices can pay for it and get the screening done rather than waiting for it, right? So these are three different approaches that this enterprise is trying, and there is some success in terms of getting the procurement from government, or the trying it with the community health entrepreneur route.
Awesome. Thank you. So more like a three-pronged approach, different partnerships with different stakeholders so that, it becomes more sustainable in the long run. Ida, yeah, you wanna go ahead?
Okay, thank you, Rod. Once again, Ida here, or Ida, as you say. Did I pronounce your name
Sorry.
right?
Yes, you did. Thank you so much.
Okay, thank you. I'm very happy that there's a clear value proposition centered on accessible, convenient, and tech-enabled health services. And I'm also happy that the founding team has experience in medical diagnostics. Probably what I could add is having a competitive analysis would be good, because you might have the experience, but then others might also have the same experience in medical diagnostics and technology. And just differentiating again but this time from your competitors in this specific area. Um, yeah, just have that as a competitive analysis. This we have done with so many entrepreneurs. It always helps with getting the funding, and then finally having an outreach team. It seems like your enterprise could benefit from outreach services that would be able to reach your target market. Thank you.
Thanks, Ida. That sounds great. Priyanka, do you want to quickly respond?
Um, yeah, great suggestion. I think they've kind of done that competitive analysis, and placing the device in different um, cost category or impact category have actually helped them in positioning the device better in different segment, be it private or public health segment. So that was helpful actually.
Thank you. Thank you so much. And we'll move to our last case for today. Let's move to the next slide, please. PeriConsult. So PeriConsult is an innovative platform based in Bangkok, Thailand, dedicated to providing accessible and confidential sexual health education and consultations, recognizing the societal challenges surrounding discussions of sexual health, especially among young adults. The platform aims to bridge the information gap by connecting users with medical professionals through various communication channels. It primarily serves young adults, particularly teenagers who often lack comprehensive sexual education, which was something that we talked about earlier. By offering services through a mobile app, the platform ensures that users can access information and consultations discreetly and conveniently, addressing potential barriers such as embarrassment or stigma. Considerations: teams made up of medical practitioners, free resources covering different topics. Users can engage through different methods with qualified doctors, nurses, and practitioners. Users under 18 services are free, with users above 18 charged a small fee, 300 baht per 15 minutes. Platform collaborates with a team of medical and psychological experts. Balancing the offering of free services for minors is a challenge in terms of maintaining a sustainable business model. Securing sufficient funds to support social initiatives and donations without compromising the main services as well. And of course, overcoming the stigma that surrounds sexual and reproductive health in conservative regions. Would love to hear any thoughts or insights from the group.
Hello?
Yes, Dr. Amos, please go ahead.
Yeah, this is a very useful skill and technique that could help accelerate the issue of healthcare, especially as regard to maternal and reproductive health issue and general diseases. But how can we partner? I'm talking from Nigeria, West Africa, Africa. How can we partner with such organizations here to scale up these techniques? Thank you.
Thank you, Dr. Amos. So partnering up with other social organizations, NGOs, could be helpful to kind of scale and maybe even help with sustainability for this venture. Maroushka, would you like to respond to this so far?
Yeah, that's actually been one of the main starting points that they're trying to build upon, ideally through working with actually with schools, with universities and senior high schools, to provide that platform for them to use as since it's free, right? um and I think that's where they've been also kind of testing how they kind of cater the educational aspect towards it, especially because you are talking to minors. How do you manage the language, the kind of information that you are sharing in a proper way? And it's still kind of ongoing for them currently, with this business.
I think that's great. And I think this is just, it reminds me of our discussion around mental health, also about who pays for it versus who the client is. And I think that's one also way, right, where we can kind of solve that sustainable business model concern here, where, like what you said, if it's through universities, then maybe the universities pay for the platform or help support it, and then their clients are the students of the university. Yeah, Mariska, please.
Actually, just to add, there was also a similar kind of case here in the Philippines with the same format. And the challenge was that they weren't really offering it for free, and they couldn't like get any buy-ins for customers, right? Because these minors don't really have enough money to spend for a subscription plan, and they weren't confident enough to tell their parents like, hey, can you purchase a subscription for me to learn about sexual reproductive health if I don't want to learn it or have that big conversation with my dad or my mom? So that was a learning, a key learning to how we also adjusted with this case. Thank you.
That's definitely a great point. Like knowing the client, right? Like they don't really have a lot of purchasing power. And at the same time, with topics like this, it's still kind of controversial and taboo, especially to ask your parents, right, to pay for something like that. So definitely something to think about when supporting these kinds of ventures and who their clients are. Silvi, nice to see you. And yes, please go ahead.
Experience if it was also offered particularly for companies with high young population, usually early 20s to late 20s. In our experience, we as an organization, we did avail of similar applications wherein it was subsidized by the company so that the company can introduce it to their workforce. And so for a month, a company pays, for example, like a lot of other mental health apps, they pay for a certain fee to allow X number of employees to access the services of the application on a monthly basis. And then they track actual usage of the application by its employees. So it becomes an employee workplace mental health application, or in this case, a reproductive health application. And then that also subsidizes other users that may not be able to have the means to pay for it. But it actually requires as well a good understanding of the sector. And in this case, for example, if there is an actual demand for this kind of services in formal workplaces, or wherein you can offer it to them, to the employees, then that would be a good, already a good way to market that application. And at the same time, possibly subsidize other users that may not have the means to do so. An issue with that I see, because there are so many similar applications in the market, it did not seem to really crack that reproductive health in the workplace concept yet. And so RH in the workplace becomes still very conservative, still a very demand basis intervention rather than a push. So it's not very successful in really reaching out people who can now make decisions for themselves and probably would want to avail of services and know who to ask. So there's really a potential market if it is marketed as a workplace intervention, RH in the workplace, then it subsidizes all the other users in the community, those who might not have the means to access it. Thank you.
Thanks, Silvi. Definitely a great point. Maroushka, would you like to respond?
Right. Actually, that's a great idea. I think part of what they've been doing is that they have pursued some corporate partnerships, but I think they haven't packaged it in some sort of a health benefit standpoint. It's more of like it's just a one-time thing for like corporate events, and then they kind of introduce it as a freemium model service. Initially kind of you get your first 3 months free, and then if you like it you get a discount at an adjusted rate before you start on the whole plan. But that's definitely like a great idea, and thank you for sharing that. We can actually send that across. I don't think that's been discussed before. Thank you very much.
Awesome. Thanks so much. Thanks, Yildi, and thanks, Maroushka. All right. I think we have we're past the hour, but thank you so much for all those who have stayed with us and really joined the conversation. This is really great to see and hear about all your ideas and insights on our case studies. That was definitely an awesome activity. So again, we'd like to thank Maroushka, Priyanka, and Keisha for joining us today. And we'd like to hear one last thing from the three of you, which is your number one advice or kind of tip for our incubators on how they can best support entrepreneurs who work in the reproductive or maternal health industry. And while they're doing that, I will also bring up our poll just so that we can get your feedback on how the session went and how satisfied you are with our discussion today. All right, so I will start in the reverse order. So maybe I'll start with Keisha on her tip for entrepreneurs, and then we'll go to Maroushka and then Priyanka. Go
Feel
ahead,
like
Keisha.
it's the thing I say I've said consistently or all the time, but I'll hone in on it, is just design for the user, right? So whatever the entrepreneur actually needs in terms of the support, not every enterprise is the same, and this is definitely not a one-size-fits-all approach. So just design for the user and support the market. That'll be it. Thanks.
For the user. Thanks, Keisha. Maroushka?
I feel like I'm also sounding bored to that as I explained through what I shared earlier, but kind of like a statement would be like the support that we give is not just a function, not a business function, but it's an experience for both parties, for us to share what we know, to kind of be that intermediary with sector experts that we can provide for these entrepreneurs, kind of ensuring that they are at a stage where most that we support are like within their early stages. They're very vulnerable, they're uncertain, or they're in high stakes moments. Like it's either they have a short runway. So being really empathizing and ensuring that it is an experience for them, to make the most out of it and ensure that you are there to kind of um know where to pivot along with them. So yeah, that's my word for it. Thank you so much.
Awesome, Maroushka. So empathy and support really go a long way, especially with working with entrepreneurs and navigating these, unpredictable waters. So definitely agree. Priyanka, to close us off.
Uh, yeah, so I think along with the incubation support, there's also a need to provide them the market access support, connecting them with relevant channel partners. I think it's something that I would advise so that the innovations, are sustainable in the long run. Thank you.
Awesome. Thank you. Thanks, Priyanka. So really around market access, also support there and, helping them with getting to know the communities where they can also go to market is definitely a very important thing that we can provide as incubators. So thank you again to our speakers for the day. This is a really great discussion. And thank you, of course, to our audience. You were very great. And I really loved all the insights that we were able to get from the activity. Um, I'd like to quickly show our next events for the next few months. If we can bring up the slide, Madura or Aditi. Um, sorry if I if that was not okay, great. There we go. So for the next month, April and May, we have a few sessions coming up. So April 23rd, we have had a discussion with investors and incubators in East Africa during the SANCOP forum. And now we're trying to validate the insights that we got from that discussion. And if you'd like to join us, that would be great to hear also your insights or the insights coming from what we've seen during that session. This is focused on East Africa insights so far, but we are planning to bring this to other regions within the network. But if you're interested to learn more about what we've learned in East Africa, then please join us on April 23rd. April 30th, we have a dialogue with funders exclusively for our members, where we have invited the Shell Foundation and Boehringer Ingelheim to join us and to discuss things at a more personal level so that we have more of these relationships with our funders, and it's a space for our members to also ask their questions to these funders, including their priorities, how they think about funding, etc., etc. So if you'd like to join us, that's another good one. On May 8th, we are talking about the shifting funding landscape with these different big groups who have pulled back support, right? In the recent months, we want to see how different actors such as incubators, a strategy consultant on fundraising, and even a funder are thinking about adapting to this shifting funding landscape, and have a discussion with the network around that on how are we moving now that there's less support, for example, in some bigger organizations. Where do we go for support, or how do we move from that support to other streams of revenue? So that will be a great discussion to have all of you part of. And then on May 14th is our last installment for the series of healthcare incubation state of play called Insights and Action for Thriving Health Innovations, where we invite other ecosystem stakeholders, such as entrepreneurs, a funder, and an investor to talk about their experiences working with incubators and also giving their tips and insights on how we can better support healthcare innovations. And then lastly, at the end of May, on May 29th, we have a session around making your impact data and stories speak. So it's all around impact measurement and storytelling. So how do we make sure that the way that we're telling our impact stories to different stakeholders, including funders, your investors, your entrepreneurs, are able to both inspire them and are effective in collaborating with them or partnering with them, right? So these are our sessions in the next few weeks, and we hope to see you there for those. So that's it for me. Thank you so much for staying 15 minutes after the time. This is a really great discussion again. Thank you again to our speakers and all those who stayed. We hope to see you in our next Pollinate Impact session. Thanks everyone, and have a great rest of your day.